You don't need to go to the AMA at all for anything, unless you're in a car wreck and you lost an arm, or you need surgery, or you need first aid real quick, or you have a heart attack, you feel like that, yeah, you're going to go to the ER. Allopathic is emergency and surgery. Diagnosing, I mean, they're lost in diseases, they don't exist. So if you want to fight and treat diseases, then this isn't the channel for you, because you'll never get well, because that's what's been going on for what, a couple of 100 years, and all we see is about what, 1.5 million people killed each year at least now. You guys have to start empowering yourselves and get away from this medical, I need to have a medical doctor tell me, because that's the problem. And it's fear-based, and the problem is it's taking the truth and it's taking the understanding and the control of your own life out of your hands. And now we have a modality that's extremely out of control. Extremely out of control. When you say there's only one health modality and it's not God-driven, that it's money-driven and pharmaceutical-driven, there's something wrong with your thinking. And it's just what we've accepted in our world. We've accepted, oh, we have to have a medical diagnosis. Do you really? I have people that have had the worst cases of cancer and everything else, never diagnosed, went through that, and cleaned them right out. You could tell they had the cancer cells. Big tumors everywhere, never diagnosed, went and cleaned them right out and got themselves well again. Why would you need to be diagnosed? Now, if you need to and you have some pain, you really want to see what's up, they got the nice equipment. I don't mind that. Get digital CAT scans, not so bad if you get digital. Your CAT scans, though, you have, what, 260 some rads or something like that? So, you know, some of the diagnostic procedures are cancer causing. Is that what you want to put yourself at risk, especially if you have a lot of inflammation in there and just that radiation? Look at the mammograms, cancer causing. Not deniable at all. The only reason the government backed off on them was the ladies out there insisting that they need them. Those are the poor souls that didn't realize that's part of what causes cancers, mammograms. Heck yeah, you each can fix your body no matter at what level you're at. We have the most mutated beings we've seen. Their body realigns itself, pulls himself back straight. You could have an allopath, they can't do any of that stuff. So why would you go to an allopath if you need a diagnosis, you felt like you had somebody to say, but if you want to diagnose about a disease, then I think you're off kilter. But if you want to have an area looked at to see if you have a tumor there or see what's up, absolutely. Get an ultrasound or something. I love ultrasounds. I looked at a lot of hearts and things before in my life. I have no problem with that. But don't think that you need an allopath to get yourself well, because that's the problem. These guys are not known for that. There are some good allopaths, don't get me wrong, there's some good medical doctors out there. But those are the ones that are doing this. Those aren't the ones that are giving you the pharmaceuticals. These guys are dangerous. And you must protect yourselves. You know, unless you need a scan and you want to know whether you got a tumor here or a tumor there, detoxify. Get yourself cleaned out. You know, if you feel like you have a tumor or something, you want it looked at, by all means, of course, just take the least toxic procedure or diagnostic procedure you can. At least get the least toxic one. Protect yourselves when you do. Try to get digital CAT scans and stuff like that. Then you'll know where the problem is, and now you can know what you already know what you're going to do no matter what you find. Because there's only so much in the body. You have to understand, it isn't like, oh, there's all this stuff going on and we don't know anything. It's a mystery. The body isn't that big of a mystery, guys. You've got a bunch of cells and two major fluids to take care of them. Nutrition in, sewage out. So that's what I'm saying, is that's a focus no matter what your diagnosis is, because there's only two systems in the body that's taking care of your cells. I mean, it's almost like some modalities out there think that there's this endless world of diseases and the bacteria on the planet are attacking you and, you know, all of this sort of thing. This is the very thing that's got man into trouble. It's got him scared to eat, scared to death. We radiate our foods to death. We destroy our very foods because we're afraid of bacteria. And yet there's nowhere you're going to go that there don't exist. You can even be the little boy in the bubble and they'll find you. It's just, these are serious microbes, and they have a serious job to do. By God, not by man. And we can't change that no matter how many we kill and mutate. You know, we fight MORSE because of that very thinking. Let's kill the bacteria. Let's don't pay attention to what thereafter, let's not go after the sewage and the acids in the body. Let's go after those that are trying to help us get rid of them. That's the thinking when you think about allopathy. We need to make sure we get diagnosed from those people that have it all wrong. And when you have it all wrong, you can't cure anything, which is just what you see, and you hurt so many in attempting to do that. I've had a lot of blood chemistry seminars, and I particularly have a unique way that I look at it. I look a little closer to stats than what's out there. Sometimes these normal ranges are way too wide, and some are way too high. So it doesn't do them any good either to have stats that are not within the ranges they should be within. But it's all biochemistry nonsense. You know, some of it's just because you can't to change any of these stats is to get yourself healthy. So we can play the game of intellectualism and stats and everything else. I play that game, obviously. But if you didn't know about them, don't worry about them, because there's only one way to fix them anyway. That's the problem. There's only one way to fix these stats. And that's going to be through getting the body healthy. This is the only way to do that, to make tissue healthy again. Bring it out of its genetic slumber and clean all the acids and mucus out of your body. Now, you've got a finely tuned machine that'll do you extremely well. You know, you can't see through radiation, and then you have radiation in your body. You know, there's always, it seems like when there's a tool that we have medically to look at something, which I like tools. You know, I'm an old carpenter, so I like tools. But they seem to be toxic to us. They seem to invade or damage the cell, so I like the new digital stuff. And everything has its limitation in what it can see and can't see, including iridology. Here's the big problem. The medical community, again, is using the blood to try to see what the problem is in man. The blood is a fraction of the evidence of a problem, and in most cases do not show you what's really going on. Many of you have come to me with perfect blood work, and I can get you perfect blood work, and you still be full of tumors and acidosis. Why? Wrong system. Now, the blood is showing the liver enzyme elevation, which is positive, because that is probably a lymphatic problem. That is where you can see some factors in blood. You also can use your antigens and things like this, your cancer markers and things like this. Yes, 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 yes. So there are ways to use the blood to determine that, absolutely. But what is, hands down, the best tool that man has been given, that he can see the whole shebang with one look? CAT scan? Nope. MRI? Nope. Iridology. Iridology. You combine blood, iridology, symptomology, and you've just about got everything that's going on. You've got a full picture of the human body and what's going on. You get to see the genetic weaknesses and strengths. You get to see the level, the condition of the lymphatic system and of the cells. Where are the cells and what tissues? You can't beat that, and it was discovered and brought out by a medical surgeon. And that's what they should look at. What's the stats on truly healthy people? They keep changing their stats because everybody is breaking down and they keep going up, so they keep moving their stats up to rectify it. Like your PSAs, they moved up from 3 to 4. Your blood sugars, they're like, well, you can have 123. And you know, they just creep up on all these things. Your children that you're raising, you really need to teach them how to add and subtract in their mind, not on a calculator. Because when you start using calculators and then you're asked to do it without a calculator, it's like, see where I'm getting at? So if you're used to using tests to answer your questions, or you're used to looking at, you don't have any consciousness of your own. See, that's what gets me. Every practitioner needs to have their own awareness, their own consciousness. They need to be able to look at the human body, know exactly what's wrong when you see a symptom. You don't go, I've said this before, you don't go to a mechanic. When you get a noise in your motor, you know, most of you don't want to go to a mechanic that goes, I don't know. Let me tear that up. Let me tear your motor apart. I'll find it. Or when you go to a mechanic, he goes, yeah, that's your alternator, we'll replace that and you'll be done. That's who I want to go to. Well, or let me run a test and let me, I'll see if I can find it. You don't need to do that. A true healer of the arts knows the human body and knows the lymphatic system now, because we've introduced, when did I introduce that? 20 years ago or more?